Guillaume? Wonderful, wonderful. So thank you very much. I think we see very interesting perspectives, and one thing which is striking us to see that some countries like again Denmark and Sweden already have quite a good experience at national level. What would be your main takeaways based on your experience? As you mentioned, there are concerns to ensure that moving up, scaling up at European level would bring a lot of mutualization of resources, but there may be some risk. So what would be your key takeaway based on your national experience that you could share? Advice or recommendations?
That's a big question. The easy answer is making it easy for your researchers, but not making it too easy. As there is a prospect of it should be easy, and the researchers, don't get me wrong, it should be easy, but it shouldn't be too easy to take away the data. And also have a very good look at trying to keep the trust. Keep the trust or heightening the trust. If you have low trust, try to heighten it. And if you have a lot of trust, try to keep it. And make that your main thing, because if we lose the citizens' trust, we've lost all of it. Then there will be a riot, or I don't know, but it will be very fast to lose that. In Denmark we've worked with digitalization for 30 years, so we have a lot of experience, and the eHDS is so fast. Regarding this, and you need to be careful. So if one takeaway is maybe if you're a new country walking into this, you need to look at other countries that have done it for a long time and maybe take away the good things, because we have a lot of experience also with what are not good things. Yeah. What can you do differently to make it easier? In Denmark, we've looked at the complexity for researchers to get data at different entities. We have it just like you in Sweden. You have not an obligation to give data, even though you have a permit. So trying to centralize that part and making the evaluations the same is one takeaway, which the eHDS also provides. So, yeah.
So you mentioned kind of standardization, standardized approach.
For some parts.
Just to understand well your comment, you said something very interesting. You said we should make it simple, but not too simple. What do you mean by that? Because I would say for most researchers, they would say the simpler the better.
Yeah. And I get that.
So
and I get
what
that.
do you mean by that?
But if you make it too easy, then you lose the trust of the people whose data you use. If you make it's that's why we never talk about ethics, because it's an ethical problem. It's not a legal problem per se, but it needs to come with some hurdles, because
allow me to propose a rewarding. Let me know if you agree with that, to see if I understand well. When you say it shouldn't be too easy, you mean there must be a level of trust which is secured.
Yes.
But could be as easy as possible as long as we have this level of trust? Yes. Or is there the idea we should bring some hurdle just to... is it about the level of trust, compliance, or...
No, I don't think it's...
filtering?
No, I think it's more that it shouldn't be, just here is my paper, give me the data. Yeah. Basically, it's like, of course, you need the ethical approval. Yeah. Or if you take away the ethical approval for some data, then you need to replace it with another safeguard. I mean, you still need to make sure that the persons whose data you are using feel secure enough that, someone has actually checked that this will be
so
used.
There must be a check. Yeah. So the idea is to make it simple, but with the adequate level of control, check and control.
I think in Danish law, the full automation of an if you make an application and an approval, if you automate that from start to finish with an AI bot, it wouldn't be legal. Because you put your evaluations under rules, and you can't do that in Danish law. There has to be somebody who makes an evaluation. It can be a short one, it could be a long one, but there needs to be one. There needs to be a person. Yeah. That's also why we...
the loop.
Yeah, it's also why we have difficulty in Danish law not putting in AI bots and underpinning personal medicine, because we lack the responsible person if it's an AI that does it. It's the same kind of thing. There needs to be somebody responsible for this. Yeah.
Okay, very interesting. Guillaume, regarding this experience at national level, regarding also the fact that we will now have with the early process implementation of EHDS, quite a number of experience and feedbacks from the research community. What is anticipated to ensure that there is this, as you mentioned, sharing of lessons learned and sharing of feedbacks? How do you see the mechanism? What is planned to ensure that you can, at the level of DG Health, collect all these feedbacks, inputs to ensure that the implementation is as efficient and as smooth as possible?
Well, thank you very much. I think that's interesting. I mean, in the short term right now, what happened is that there's a lot of projects that's going on, a lot of joint action, a lot of projects, a lot of initiatives, which some of them I could mention, like TEDS2, community practice, which are there to provide the raw material to the European Commission to actually design, to put them in the implementing act, to develop the data that would be needed to actually make this system work. So this is, in the short term, I mean, we do try to leverage what was mentioned before, the existing experience, to ensure that we don't start from scratch. Because we're not totally talking about the revolution here. What we really try to do is try to, and DHS also does show that, we try to bring up the best out of the national system and to design a common European system. In the same way for implementation, we try to also to take up some of the best elements that we have at national level and to scale up at European level when possible. Of course, there are some elements there that will need to be drafted from scratch, but as I said, we're not trying to revolutionize the whole thing, we're trying to pick up the best stuff. On the more long term, I mean, what you have to go to see is really the governance model that we actually built on the HDS. And one of the key pillars of the governance model is going to be the HDS board. And this is the HDS board. You're going to have members both from primary use and from secondary use and from all member states. And they're going to talk to each other. And they, as was mentioned before, they're going to say, okay, don't go this way, try this way. We've done that before, it doesn't work, or we've done that before, it's going very well. And then people will take all this experience and this sharing of knowledge and try to avoid common mistakes and try to share things that work. So I think this is the key point there, is to harness all the assistance to scale up all national experiments and initiatives you have, and to scale them up to the best one, to scale them up at European level.
Thank you very much. How do you see then, for many researchers, so there is an interest to collaborate internationally. EHDS provides legal basis to engage in international cooperation. How do you see the implementation of these opening towards non-European researchers, or thinking countries like US or Japan, with which Europe has close collaboration and for which sometimes medical research requires us to have data from different regions to avoid any bias. So how do you see the next steps to open the HDS to international cooperation?
Well, thank you very much for this question. It's going to be a very long term, that's for sure. I mean, for one reason is that potential. The first thing is, unlike other prior setup, EHDS population does envisage connection or access to data for third country user. So it is not forbidden or something like that. It is a possibility. But there are a lot of conditions in this possibility, and it also comes back to the trust issue. And really coming back to the perspective, it is one thing to trust at national level, it is another thing to trust at the European level, and it's an even further issue to trust at international third country level. So there you have it. That's the one of the reasons. And again, it will be connected, for example, between EHDS and other cellular systems in other countries will not happen within, at least for the next 10 years, because this element will only become applicable within 10 years from the entering into force of this application, of this regulation. So really, we're talking about long term. And the additional reason for that is that, as explained also by the other panelists, remember, we already have a lot of plans to get this thing going at the European level. So I think the priority for him is really to get this thing working at the European level, and then maybe to have it work also with access.
Yes, Tina?
Yeah, I think what is also important to remember is eHDS is one way of getting access to data, right? We will still have the other ways of getting access to data. And today you can collaborate internationally. It's a bit of a hurdle, as we've heard. But I mean, you will probably be able to leverage the good parts of eHDS. I mean, if we manage to get a standardization that works for EU, maybe you can use that when you're doing the international collaboration. You will probably still need to have the Swedish partner to get access to the data, and the Danish partner, and so forth. But then at least you have one. So, I mean, even there you will have a bit of a benefit of the HDS, but not the full, of course.
So you still see the role at national level as being also in direct interaction or support for international cooperation.
Yeah, I think. Yeah. I think you shouldn't lose that part.
Yeah.
And also to always remember that eHDS is one pillar of getting access to data, and you will still always have the national pillars as well.
That's a very interesting point, because one of the questions that emerges to say, yes, eHDS is wonderful, it's great to have a new instrument. But sometimes, if I take the example of research projects where you have hospitals who directly have data and want to collaborate, going through HDS is very complicated. And currently, under GDPR, we could have had, I was speaking last year with Jan Philipp Albrecht, who was leading the adoption of the GDPR, and he was mentioning that during the process, there was at the moment an article which was giving in the GDPR legal basis for the use of personal data for research. But there was a lack of consensus among so it was removed from the GDPR. Do you think that something based on your experience that could make sense to propose, so to facilitate the possibility for researchers to have a legal basis with all due protection? I agree with you, like ethics oversight, DPIA and so on, but how do you see it from your perspective as practitioner? What could be done to, again, facilitate, again, the researcher, to enable the researcher to do their work?
I think it will be hard to maybe give, I mean, you have legal basis as research in GDPR, basically, because it's never contradictory to the original purpose, right? And I know that the EDPB, the European Data Protection Board, has been working, when I was there, that's 5 years ago, or 6 years ago, we started working on the guidelines for research. They're still working on them, because it's a complicated topic. But so how have we tried to solve it? We have the HDS, but it doesn't go all the way either. So I'm not sure it's a feasible way, because it will maybe it will reach it, but I think it's better trying to find the small solutions that are there, and maybe put pressure on the data protection boards to actually give out proper guidance, because you can do research. It's actually feasible to do research. It's just that it's hard to find the way through it. So,
any views on this? Or maybe yes? Yes?
One problem is, for example, because there was some question on the ADS when we were negotiating about having legal basis and everything, and as mentioned now, the legal basis for the data users still needs to be there. I mean, it does not provide the ability to the data user to do something. The problem is that, as mentioned, if you do provide the ability to the HDS, you actually also changing the GDPR and basically saying, well, you have all these legal bases, and on top you can have a legal basis with the HDS to ensure that the end user. And as said, I mean, the issue, but the thing here, we want to work with the GDPR. We want to build upon the flexibility of the GDPR. As mentioned, there are some flexibility in relation to research on the purpose, but the purpose of the case was not to change the GDPR. What really we're talking about here is, okay, so there's some maybe something that needs to be updated in the GDPR, but that's not the point of the HDS. The HDS, as mentioned, is to provide another path compared to the available path to provide access in a common way across Europe to some type of data for a specific purpose.
So in other words, the idea is the HDS to be an instrument, a tool, but not to serve as a legal basis for the data processing. Is that correct?
Well,
not for the user.
It does, because we need to have that. But it's still within the framework of the GDPR. It doesn't change the GDPR in itself. I mean, let's say. So that's what I want to say. It's not there to change the GDPR, because that's the thing. You have to work with what the GDPR provides.
It says the EHDR says that it is a supplement to the GDPR and has to collaborate with the provisions of the GDPR.
Yeah,
so
but the GDPR said that the lawfulness can be based on legal basis. So then the EHDS could be claimed as a legal basis for the data processing. So the question is, as you mentioned, it's not to change the GDPR, but could researchers use the access to HDS as a legal basis for the processing of the data or not?
The thing is that the data users always need to have their own legal basis, and they don't find their own legal basis in the EHDS, right?
So it doesn't...
provide the legal basis for the data to do its work in order to process data to make it available for the data user.
And what it actually does also is that it provides the purposes. So it doesn't provide the legal basis, but it does provide the purposes. So data can be used for research purposes, but you still would need a legal basis to use it for research purposes. And that one you would need to find. You would have your own, so to say, legal basis for it. That's how I would interpret it. Back to, we're going to interpret the HDS as we are interpreting GDPR for I don't know how many years to come. So anyone looking for harmonization, I'm sorry.
No, but it's very interesting, I think, because there are different interpretations. That's very interesting because, again, I think one of the main concerns, maybe Annalisa, yes? Microphone? Or do you want to maybe use this one?
Turn it on.
Oh, this one?
Oh,
okay. Do you want to try this one, maybe?
Thank you.
Can you switch on this one?
No.
Yeah, message.
No, it's possible.
Thank you, Sébastien, and thank you to all the speakers. I mean, the main concern that we always raised as researchers is not that we cannot do research, but is the heterogeneity across member states that is taking us not 2 times, not 3 times, 10 times, okay, the time we use, okay, to take for a research. And this is our main concern. So the first thing is the heterogeneity, and we were really hoping that the HDS would have helped to reduce this heterogeneity. From what I got this afternoon. This doesn't seem the case, despite, and I really look forward to maybe the best practice, you were mentioning, so that maybe across countries, you might maybe in a better position to ensure a more homogeneous, approach.
Yeah, but
the other point, that I just wanted to make is that I understand that it must be easy, but not so easy. But please consider that there is a risk here, okay? That is, we need to consider that every researchers, everybody that has a good idea should be able to apply for data, okay? We grew up knowing that we need ethical committee, that we need now the revision of privacy issues, that we need legal agreement. I can tell you that I'm lucky because I'm working in a huge health research institute that provides me the legal expertise to addressing this heterogeneity. This is not the case, okay, for all the researchers that might not necessarily work in an institution that provide this type of support. So again, please, when you think about, make things easy but not so easy, think also that everybody, even without having the support that I'm having, should be able, without spending nights, because this is also, the time that often researchers have for dealing with all the administrative procedures.
We know.
When they don't have, a
Your
support.
Researchers, we're legal representatives, and there is a difference.
So really, please consider that in addition to the problems that you might have at national level, okay, what you're facing at national level becomes, 20 times complex when you're trying to deal with European project or with multi-center, multi-country within Europe.
But this is the problem that the EHDS should address.
Yeah, but
that is the plan.
Clear how. To be honest, from this conversation, if you can maybe better explain how the HDS will solve the problems, I will go back home much more, light.
Yeah.
Because it's not clear to me from.
Yeah, I think the
said.
Danish context is that in Denmark it's relatively easy, though it has problems that you need to go to different entities, but your argumentation and your search for the data is a relatively easy way. It is relatively easy in Denmark to get access to data. So there is some hoops you have to jump through. It needs to be some, not a lot. And we agree on that, because you are researchers and you should do research. We are lawyers, we need to do the other part. I can only speak from a Danish point of view. We do a lot of advice, give a lot of advice to the ones that apply for data, and we also tell them where they can get advice in their own entities and point them that way. So we need, and they have, most of them have really, really good people to underpin them. Of course, if you're a lone researcher, then there is another problem. But some of it is to educate, to have good solutions that can underpin the researcher, making the application easier and good. And the EHDS also provides that these applications need to be judged in the same way across the country, even though there is an ethical approval. It needs to be judged the same way.
Mm-hmm. Yes, another question?
So as far as...
No. No. It's not true.
So as far as I understand, you are adding an additional level of verification, which is an additional level of complexity.
No, we're not. In Denmark, we're not.
I'm not speaking of Denmark.
No.
I'm speaking regarding the EHDS. I live in Italy. I've been working with hospitals which are not specifically research centers, but there are researchers there. And their lives is completely difficult, and some of them don't do research anymore because their lawyers are afraid of, let's say, completing all the procedures regarding the, let's say, the use of data. And this is one point. And the second point, which was raised by one of the speakers of the previous session, is ethics. Okay. So you, Tina, said, okay, ethics is completely different aspect, but in research, so how is, let's say, the legal, let's say, management of data offered by the HDS dealing with the ethics research requirements that emerge from many European initiatives, including, for instance, the European Beat Cancer Plan, the equality of care, which is another goal, another pillar that the EU has established. So I think that in some way, maybe not immediately, but in future, this aspect should also be taken into consideration. Because if we make barriers towards easy research, the research results will be probably and possibly delegated to the private organization.
Yes. Can I answer the first
page? The pharma, who might have biased results.
Okay.
Thank you very much.
I think I'll try to answer the first part. I think you misheard or misunderstand my enunciation about I don't want to make research harder or getting access to data harder, but there needs to be some hoops you need to jump through. They don't need to be large, they don't need to be difficult, but there needs to be some. I'm not a fan of making things difficult or even more difficult. That's the EHDS. It should make it easier. It's the purpose of the EHDS to make it easier, to have a good process for accessing data, for making applications and having data. So if it was understood in another way, then I'm very sorry. It wasn't my intent.
Absolutely. I think there was a clarification. Maybe, yes, we are already at the end of the hour. What I would suggest, if you agree, all of you, what we hear, that fantastic instrument, which is on the way to be launched at European level. There are concerns from the researchers, because one of the main issues for researchers today with the GDPR is to have the legal basis for secondary use of data, which means that the usual way you get the lawfulness basis is through consent. For researchers, usually consent is not doable. If you do research on rare cancer, you cannot go back to, it's even emotionally difficult to go to someone whose children is, or child is going through such a tragedy. Oh, by the way, would you give me your consent for research? So very complicated. So maybe one recommendation from each one of you, just to close the discussion. What would be your recommendation to ease and to address this concern of the researchers? How to ensure that they can leverage on secondary use of data in a lawful manner, an easy manner for them as researchers. What is your suggestion? I don't know, Guillaume, if you want to start, as you have the global vision, and then we conclude with our colleagues from Scandinavian countries.
I mean, for me, as I said, I mean, eHealth, as I said previously, eHealth is a new tool, it's an additional tool. It's not there to replace a tool that's already available to have access to the data. So, to have a look what eHealth can do for researchers, and there are purposes and everything, so there's lots of possibilities. The type of the best data that made available is quite good, and it's available across Europe. So have a look, try to integrate that in your query when you start taking data. Maybe the agency can help me out. Let's have a look at what type of data that can have access to and whether it's feasible or not. And because it is streamlined across Europe, hopefully it should be less worrisome for different group of people, have ability access to a broader range of data.
Thank you very much, Guillaume. Tina?
Well, I think you should take away that it will be easier in time through eHDS to at least anonymize and pseudonymize data, and not as many hoops to jump through. So I don't think we should be worried. So I think we will leverage the good parts here, and we will be able to move forward. But I still think we need to bring with us that it's a new tool, and it will take its time as any new tool.
Thank you very much, Tina. Sigrun?
Yeah, I don't think I have anything else or different. I really have a hope that it will be faster and better, and also that the amount of data available, both to governmental but also to private entities, will be very much larger, and that's also a takeaway.
Yeah, very good. Thank you very much to all. It was a very interesting debate, and a big applause to our speakers and experts.